Hi, my name is Dr. Sunil Sharma. I'm a bariatric surgeon and director for New Life Surgical Associates, Jacksonville, Florida. So today I'm going to talk about basic suturing skills, and this video is intended for anyone who wants to learn the right way of suturing. It can be used by physician assistant students or medical students or younger residents in surgical training. So in this video, I will talk mainly brief general information, what I think they should know about the sutures, the needles, the equipments and how to hold the equipments and or the instruments and the proper movements. So these are the basic principles for suturing. And the next video, I will talk about different type of suturing, subcuticular, continuous, interrupted, so on and so forth. So just the basics about the sutures. You should know the difference between absorbable and non-absorbable sutures. So if you are closing the skin, you would prefer a non-absorbable suture if you are doing interrupted stitches, or if you are doing a subcuticular, which is a buried stitch, you would use a absorbable suture. The other thing you should know is if the suture is monofilament or polyfilament, meaning it's braided. And the main difference is the monofilament is less prone for infection, but it is harder to carry and have to put extra knot to make it stable. The typical example of monofilament is proline, which is non-absorbable, or monocryl, which is absorbable. For polyfilament, absorbable vicryl or non-absorbable will be something like silk. So you need to know what kind of suture you need. Then also the size of the suture. If you are doing a finer work, you will need a thinner suture. So the thinner the sutures, the more O they have. 1O, 2O, 3O, 4O, 5O, 6O will be very fine suture. And on the other side, it gets from 0 to 1 to 2 and it becomes thicker and stronger. So depending on the site you're using and the strength you need, you decide what size of the suture you need. Coming to the needle, you should have a right length of the needle. So length is written down, maybe 3 millimeters, 4 millimeters, 5 millimeters. Besides length, the other important thing is the curvature of the needle. It's a 3/8 of a circle or a half circle, and it depends. If you are doing a superficial closure, you will need 3/8 of a circle or less of a circle. Also, the tip of the needle is very important. There are two types of needle with tip. One is the sharp cutting, which is used for closing the fascia or subcuticular stitches, and then there is a non-chromatic needle which has a round body. It is used for closure of something like small bowel, where you don't want to create too much tear or trauma. So having known the basic of the suture material and the needle, the second important thing is instruments, what you will be needing. So here I have a needle driver and a pickup. Before I get into how to hold these instruments, you need to know the movement. As the needle you're working with is not a straight needle, it's a curved needle. So all your movements should be curved. The movement should be pronation, supination, like that. So it's the rotation movements, not forward movements. So if you rotate the needle, they'll be least traumatic, least resistance, and will come out best. How do you hold the instruments? This is the needle holder, and you can use the ring finger and thumb to hold it, or sometimes you can open and close just using the palm. So whatever gets comfortable. Sometimes holding the needle holder with the index finger can stabilize your needle driver. Again, all the movements are going to be circular movements. And this is the pickup. You hold it like this and try to grab the needle perpendicularly so you are stable. Again, pickups, there are two types. One which has a sharp tooth here, has a better grip, but more traumatic. Then you have pickup, which has no teeth here and has some transverse, very fine serration. It gets you the grip, but not as tight as this. So if you're planning to close or learn suturing the skin, then I would use a fine adsum pickup with teeth. So these are the instruments used for it, and I will just give a brief demonstration how you're using it for a stitch. And as I said, this is I believe 3/8 of a circle, and that's the suture. This is the vicryl suture, which is absorbable. How do you hold the needle? So the point where you will hold the needle is the junction of anterior 2/3 and posterior 1/3. So that would be the site. That will be the most optimum position. The needle driver has the tip, and you need to hold with the tip. So the right position would be this. And the needle should be perpendicular to the needle driver. Many times you will see students holding it like that. That's not the right way. So it should be tip at the anterior 2/3 and posterior 1/3, not too far anterior or posterior. So this will give you the most ergonomic advantage. So that's the holding, and that's the pickup for this. Always try to suture towards you. So if you have a long incision, instead of starting here and moving towards the head, I would start from here and bring the sutures down. That's the basic principle. You start with the most pronation position. The tip should strike the skin perpendicular. So it goes in, pierce, and then you just follow the rotational movements. And then re-grab with the pickup and use the circular movement to take it out. Now, this part is called as the tail. You should keep it very short. I will demonstrate the instrument tying. So this tail should be kept very small. With your left hand, if you're a right-handed person, make 2 loops around the needle driver, stabilize the needle driver, hold the tail with the tip, pass the loop, and try to make it tight. Once it's tight, then try not to put tension on the loop. Make one more loop, grab this thing, the tail, and move it in the opposite direction. See, the tail is towards the head. The next suture will be tail towards you. So this is called squaring of the knots. Very important, very simple to do. All you need to do is keep repeating. So this is in a nutshell the basics of suturing. I emphasized on the instruments, sutures, just broad knowledge, and the basic principle of movements. Practice more and more, and the practice will make you perfect, so that one day you will have this essential skills which you will use it every day or when it's needed. And good luck. Thank you.